So, if you don't mind sharing a little bit about your background and how you decided to be a marriage and family therapist.
Oh my, that takes me back a long way. It wasn't my first career. I started out in church work. What typically in this part of the world we talk about being clergy, and I thoroughly enjoyed the counseling side of the work, but not some of the political stuff. So I bounced around, did a few other careers. I worked in automotive dealerships. But I always kept my hand in the counseling concept. I actually spent time working on a telephone crisis line. And then I figured with the stories I was hearing there, I needed some more education. So I went back to school and completed my master's degree and took an additional postgraduate studies. But that was sort of triggered by my life experience all the way along. I wanted to relate to people more, either one on one or with couples or families, in ways that there wasn't room for that, in my opinion, in the world of church work or many other areas. So by taking a lot of the training, I then became got my credentials within the field of marriage and family therapy, and recently retired about 5 years ago from about 35 years of working in the field. And in the last maybe 5, 10 years of my work, one of the things I was drawn to was what's called critical incident stress management, or CISM. And that involves working with fire, police, paramedics, anybody that's frontline response to, if you will, disasters or high stress issues. Incredibly rewarding work. The other was as well, but this was quite different. And that's where I spent a lot of my time in the last few years of my working experience. And even afterwards, although not officially, I do some of that, but just on a very casual basis. The work has been a tremendous education for me over the years. How maybe the simplest way to explain that is that it's one thing to be in a classroom and you're having an academic study about this kind of personality, if you're thinking DSM by codification or whatever, and you think, man, I'll never meet anybody like that. Guess who my next client was? So it was a tremendous education for me to kind of go from stuff in a book, uh, print on paper, to eyeballing a person who was describing a situation that was, if you will, textbook, and then what to do with it.
Mhm.
So I find the work absolutely fascinating, thoroughly enjoy it. Scared to death when I started it because I thought I had to know everything. And then I eventually learned that being able to say, I don't know, but let's work on it together. That's less stress for me, and I find it actually quite productive.
I remember
Back to you, Selma.
one of the stories that you shared with me was your first experience working with a transgender client, and you were worried that you don't have any knowledge or experience. If you don't mind sharing a little bit about that.
Yeah, that's a fairly typical thing. And transgender, or I'm thinking of the other one that scared me half to death, was a lawyer. I've had some interesting experience with lawyers, which I bring to the do I trust these guys? So in both cases, I didn't know a lot about the dynamics. Let's go with the transgender one. I had studied that and I had all kinds of weird and wonderful, hey, I'm giving away my age, but way back when that was considered bad and wrong. And it really was, even in the DSM world. So I thought, okay, what will I be able to offer this person? And in both cases, the transgendered person and the lawyer, once I get past my nervousness and once we get past the introduction in the first session of like, any trouble finding the place? Have you got the paperwork all done here? What brings you in? After about, I don't know, 5 minutes, I get past the labels, my preconceived what this person's going to be like. And I learned that even from those two and many other examples, once we sit down with somebody and give them a chance to talk and we listen very carefully to them, we are not that different as human beings. Yes, there's sort of the facade or the image of how they should be or how they present, but get past all the labels. And as I've said to you many times, Sam, I like labels on jam jars, not people.
Mhm. Absolutely. And this is one of the things that I really learned from you, the one down approach. sitting with a client and coming in with curiosity to understand more about their experience rather than coming in with preconceived notions. One of the things that you commented on a lot is in the beginning how much I wanted to know everything so that I can help clients with everything. I need to read all the books, I need to take all the courses, and wasn't very good for my bank account. Uh, but you saved me from that because you taught me a very important skill, which is to just sit with a client, not so far as to let the client educate me, but because that's my responsibility, but to sit without knowing, because the client is the expert, right?
Yes, yes, I think that's a very important issue right there, because it is very seductive in this field to think I got to go and get a degree in pick a topic, so I can be better able to service clients who bring that topic to me. Now, there's some truth in that. I understand. But when you think about it, when I look back over 35 years of working with clients, the number of issues that people brought me, there's no way I could have studied enough to keep on top of it. Now, I don't expect them to teach me in a sense of the stuff I would get in academia or another degree or whatever. Let me give you a quick example. Someone came to me one time, a young man from South America. His English was good enough that we got along, and it was the funniest thing in the world. He came in, he sat down, and I said, "How you doing?" And we got all past that, and I said, "So how can I help you today?" He looked at me and he says, "I don't think you can." I says, "Well, you could be right." I didn't rattle off all my degrees. I said, "You could be right." And he says, "Yeah, I am like 19 years of age, and you're an old guy." I said, "Once again, you're very observant and you're right. And maybe I can't help you, but I don't know what you're bringing to me. So what is it that brings you in?" And I won't get into it I mean, it wasn't super confidential. It was a big deal to him. He was having a life issue. And he says, "But I know you can't help me." I said, "Okay." And I said, "If I may, what part of the world do you live in?" And he mentioned somewhere in South America. And I said, "So if you were home right now, what might you do with this issue?" "Well, I'd go and meet with the elders of my group, or I forget what it was called." And I said, "Oh, okay. And what would that look like? What would happen there?" "Well, I would tell them what my concerns are, and they would listen. Uh-huh. And they would give me some suggestions on how I could handle this." And I said, "Oh, well, what do you think they might say about this issue that you brought to me?" And we went that way. I just simply got him thinking. He was right. I'm an old guy. He's 19 years. We got how many generations in between is that? But by the end of the session, it was the most delightful thing. I really enjoyed the session. He came around but I kept putting it back. What would they cause you to think about? How would that work for you? How might you do that now? How would you start doing that now? End of the session, he's so thrilled. He says, "You've been a big help. This has really helped me get through this. Bye for now and thank you." Did I know what he was talking about? Technically, no. Did I help him sort out his stuff? Yes. How do I know? He told me.
Mhm.
So that's, if you will, a model that I've used in so many situations. What are you working on? What would it look like if that went away? Now, some might call that solution focused brief therapy. In many ways, it is. But then I tie all kinds of other things into that. So if you're leading into a question of, well, what model or modality do I use, or what lens do I see clients? Well, the one that works in that moment. And
You-
I
One
have
of the
learned.
One of the things that
Go ahead.
I learned from you, and it really worked well with the way that I like think or the way I work, is that we don't stick to one model. So as I'm learning more about supervision, a lot of supervisors, they force the student to pick one model and apply it and create a case conceptualization for that client regarding like with one or two models maximum so that it's not the so-called eclectic approach. There is a structure to it. Um, and they would recommend sticking to one model until you master it, because you can't master a model unless you use it with all your clients, even the clients where it wouldn't fit. And for me, that would have been a nightmare, because if I'm sitting with a client and I can, hear the narrative externalization technique, that's what I'm going to use because that's what the client needs. But then there are other clients that need CBT, even though I wasn't a fan of cognitive behavioral therapy and how structured it was. So you really taught me how to do that, especially when it came to, um, I don't know if you remember this early struggle of mine with grief. This was about 6 years ago when I was struggling with working with clients going through grief, and I got certified. I was trauma informed, trauma certified, grief certified, and I did all I could do. I read all the books, and I couldn't do well in that session. I wouldn't pass that one session with a client where at the end of the session they say thank you, but this is not working for us. And I remember calling one client, and I said, can you give me one more chance? I think that I may have approached this wrong. And just even asking for that was something that I learned from you. And do you remember what you shared with me when it came to the grief part?
Refresh my memory.
You were saying, you're thinking of it more of from a theoretical perspective, and you're not sitting with a client. So I was so focused on helping them feel better through everything that I learned. Like what's the next step in grief? How can we move on from this? Because I was so worried about them not feeling okay that I couldn't hear them. And you said, well, you've lost people before. What would you like for someone to ask you? And the first thing that we both thought of simultaneously is, I would like to get to know I would like them to get to know the person. Like, who is this person? Who were they to you? Um,
Yeah.
Rather than pulling out a chart about grief that I took in the course on, moving on to the next steps of grief and avoiding falling into complicated grief.
And I guess the thing I would reflect on that, some is the idea that if a client's coming in with and presenting with whatever, if I or you or any therapist is really trying to put them in a box, call it a therapeutic modality, call it a lens through which we see them, then I am not sitting with the client. And that's something I've learned way back. And that's what you're referring to, the idea of I'm not going to try and get them in a box so I can label them. Now, I know it's different if you're a psychiatrist. You do want to, or they trying to get a list of, are they exhibiting the symptoms that within the DSM might give them the right to say they are such and such, and therefore we can prescribe this sort of medication. That's not what, in my opinion, that's not what I as a therapist ever did. I would try and get to know the person as they were. I wasn't interested in putting them in a box, because once you put them in a box, then you don't see the rest of who they are. Most of us don't fit in a box. I know I don't. People try to do that with me. It doesn't work. So it's nice to have the skills. It's nice to know different modalities, if you will, but it's not everybody likes this concept, but it's like a toolbox. I like to fix stuff. I've told you about renovating my old house that I bought, and you may know that means that you got a whole lot more than a screwdriver. And I remember Bessel van der Kolk, a very well-known teacher, writer, author, presenter, and he talked about that idea where he met therapists who said, well, I'm a such and such therapist. And they'd have the modality. And he used to, in his lectures, say, well, that's fine. But that's kind of like a contractor coming to your home to do some repairs. And he says, I'm a hammer contractor. And you think, was that all you got? So we understand within, maybe home renovations. So why is it different when we're sitting with someone who's hurting? They came to us for a reason. We don't know why it is yet. The very thing they tell the person who did the intake in a sentence or two, in my opinion, that was the politically correct comment they gave to the intake staff to get them in the door. But once they're in the door and you start listening to them, it's much more complex. Usually, sometimes it's simpler, but usually it's more complex. So if I'm sitting there thinking my specialty is whatever, then I got to put this person into that and then move them through the steps. You may remember Kubler-Ross when she came out, what was it, the 5 stages of grieving? And people took that as the way to do it. And they could not deal with someone who didn't go through step one, then step two, then step three, then step. And if they got to step four and they missed one, they'd try to push the client back. Structure, structure, structure. There's a place for structure and there's a place to let it go.
Mm-hmm.
And to, if you will, walk alongside the client. It's kind of like you're going for a walk in the woods on a nature trail and you both got flashlights and they want to go somewhere. Well, the both of you are saying, well, let's work on this. We got our lights. We'll work on it together and see where this goes. That's my take on it. And the bonus for me is I could stay at that kind of work dealing with some really difficult stuff without it burning me out. Because if I thought, oh boy, here comes somebody, I don't know what this is. And if I knew the day before, I might go to the library and get some books and do some reading or something online so I'd have all the answers. I've done that.
Mm.
And then when the real live client showed up, everything I dug up was a waste of time. I
Absolutely.
could give you I could give you lots of examples, but I won't do that. But just that idea
Yeah.
that studying and preparing ahead of time
Mm.
in anticipation of what I think I'm going to hear and see may in fact make the situation much more complex than it needs to be.
And forcing it forces the client to stick to the narrative that they came with. So they came with grief, so we have to talk about grief. And I remember I had this agenda, and I was taught in school to always write in the beginning of the intake form the session plan. So that was before the client would even walk in. The plan that I had for them, and today we're going to be doing cognitive behavioral therapy for these dysfunctional thoughts. And then the client comes in and they want to talk about, the fact that they went baking that weekend, and they used like 40 minutes to talk about it, and we're developing this rapport and a therapeutic relationship. Um, and by 40 minutes, they say, thank you. This has been really helpful. Um, because, and then in the last 10 minutes, the ultimate revelation of how this somehow links to the grief that they've been experiencing and how it helped. And so I wouldn't have known unless I allowed the client to lead. And I think that this is one of the greatest things that has helped me become a more competent therapist working with difficult, like the most difficult human experiences, things like even as dark as being close to death, like near-death experiences, um, traumatic events, grief, losing a loved one, losing people that it wasn't their time to go. And people think that this kind of work is very heavy. Surprisingly, it isn't always with this approach. But it would have been very heavy had I went all clinical to start, because I think that, and this is what I was talking to you about before we started recording, that I think that a lot of clients, they don't understand the difference between different providers of therapy in mental health in the mental health field. They go to a psychiatrist who has a very clinical, the proper clinical psychological assessment and a diagnosis at the end of the conversation. And they're waiting for feedback, but they don't get feedback, they get a prescription. And then they go to a psychologist who says, you have this diagnosis, but then they don't understand how psychotherapy is very different. So they come and they're expecting the same approach. And then sometimes they're pleasantly surprised, sometimes they're not. But then I think that these conversations that we're having together, I wanted to share them with people so that they understand what is psychotherapy and how it's different, and not just psychotherapy, but also the family systems approach.
Yes. So true. I mean, there's nothing. Just to be clear, I for one am not against anything a psychiatrist can do or a psychologist or other fields,
Absolutely.
but they're doing something different
Different.
and something different than what we do. I mean, I when I go to a doctor because I got an acre of pain in this area, I do expect a diagnosis and maybe here's some exercises you can do or here's some medication to help with the pain. That's a whole other story. But if I'm hurting emotionally or mentally, I need someone that's going to listen to me. And there's a point right there, I think a lot of beginning therapists don't understand. Most human beings don't either. The idea of deeply listening to someone else is not is not the same as agreeing with them.
Hmm.
And I think where a lot of folks get in trouble with the situation, I don't want to listen to so and so. I don't want to sit there and hear this person talking about how to make brownies, example from my career, how to make brownies. Why would I want to listen to that? Well, maybe, as you mentioned, it's about building a relationship of trust. And if they hear me listening to them or being attentive, then they think, okay, now I'll tell them why I'm really here.
Yeah.
Whereas if I just kept firing questions at them and so I can label them, and then what are you going to do? You still got to come back. I'm jumping around a little bit, but I've teased a psychiatrist friend of mine. I says, "You really have an easy job." He said, "What do you mean I got an easy job?" I says, "You sit down with somebody, you ask them 20 questions, you come up with a label, then you send them to me. I get the work." And I said, "Thank you very much. I appreciate it." But there's something to be said for I don't like labels except on jam jars. I in my brain, I'm thinking, no, there are, in all fairness, there are times when I think, okay, this is something a little different than my skill set is good for. Like what? Schizophrenia.
Yeah.
Schizophrenia. I've had a couple of clients, they come in and I'm no expert on that and I'm not licensed or allowed to diagnose, but I've done enough reading to know this is outside my field of expertise.
Mhm.
I'm going to get a medical consult on this. And that's what I do. I build a consult and maybe I work with the doctor or the psychiatrist to do some day to day support for the client.
Yeah.
So you know what your limits are. Um, but the work we do is so different. We don't, but we're not allowed to diagnose, and we don't try to diagnose. We try to understand. And then by reflecting that back to the client, help them understand themselves and what they're going through and how, if necessary,
Yeah.
they can make changes that will make their life better. But
Mhm.
that's through us, if you will, holding up a mirror to them, reflecting back what we're hearing with maybe a question or two.
Yeah.
If you were to achieve your goal, what would that look like? That kind of questioning. And
Mhm.
to cause the person to think in terms of, well, I'd be able to do such and such. Okay, so what would be the first step that you could or might take to get towards where it is you want to go?
Mhm.
Those kind of questions. We're not saying, well, obviously, from what you told me, you're a such and such, and that means this is what you are, and this is what you have to do to make yourself better. Because
Mhm.
I don't know about you, but if someone did that to me, I would tell them where to go. And I don't know what the language is in Arabic for that, but you know what it is in English.
There's a time and place for going to a psychiatrist, and there are times where I would tell a client who says, "No, I really want to do talk therapy," and I say, "No, you at this point would need medication," and we're trained to know the difference. Like you said,
Yeah.
in schizophrenia or with even depression, sometimes therapy alone, talk therapy alone, will just take too long, and it's just better to
Yes.
start on medication. So there's a time
Yes.
for psychology, there's a time for psychiatry, but there's also a very different place for psychotherapy. And this is one of the things that I'm noticing that a lot of the clients are not aware of. So when they initially seek help, they're thinking, well, hey, this is different. First of all, she's not
Mm.
sitting behind a desk, so that's interesting. We
Yes.
went to
Yes.
someone before and we talked with them for an hour, but they didn't give us anything. And sometimes it's the other way around where I would get a client who's very disappointed from the last mental health professional they went to because they didn't listen the way that I listened or they weren't as interactive. And then I would tell them, well, did you go to a psychiatrist? And they would say yes. And I would say, well, you can't compare. The psychiatrist sounds like they did their job. Um, And here it's different. So it's not that I'm better. It's just that, or, more interactive or more interested, because sometimes they think that I care more than their psychiatrist, which is not true. It's just that I'm offering something different. Psychotherapy is different. And as I told you before, like here in Egypt, psychiatrists, because the medical professional is positioned in a way where psychiatrists would supervise young psychotherapists in training. Because now there's the many psychotherapists graduating and they're doing their training in Egypt, but it's always the led by a psychiatrist telling them what to say in the session, which I found very interesting because if that had been my experience, I think I wouldn't have been able to do the kind of talk therapy that I do now because you need students, young therapists in training or therapists in training, not always young, need to learn from someone that has been in a room through the difficult conversations. And that's what you were able to help me with, these how to be present in a difficult conversation. Conversations about like near-death experiences, for example, or traumatic experiences. It's not enough to be trauma informed or trauma certified. So I wanted to ask you about that. How did you, or why did you decide to complete your certification in trauma?
Oh my. The short version is I had, well, as I've joked before with you, why am I in the field? Well, it's cheaper than going for my own therapy. But when I was, I think there's some truth in that. But when I was studying about trauma, I started to realize that that stuff is really hitting me emotionally. And then I thought, well, what's going on here? And between some of that, stimulating that sort of self-reflection and studies on family of origin work, which I'm sure you've shared with folks where we go back. And hey, by the way, this is not where we go back and blame mom for everything that happened to us. That's not it. But it caused me to look back at some of the traumas I was through in my own life. And for example, it wasn't until I was almost 40 that I connected the dots enough to know that because of such and such when I was around 9 or 10, I probably took a life path in reaction to that instead of making choices based on other things. So it was very intriguing, and it was informative. It was helpful. It helped me to grow, and then it gave me the courage to step in and not be afraid to walk in to do what we call trauma intervention, say in a fire hall or a police station after a fatal, especially fire departments where, as you know, firefighters, at least here, see some of the worst of the worst when they go into burning buildings. So instead of being terrified, as most clients are, if you were to sit down with a group of firefighters the day after a bad call like that, I've had coworkers or colleagues who said, man, there's no way I'd go in there. I don't know what to say to them. Like, go in and relax and deep breathing so you'll feel calm. And don't do that, won't work. But I learned some other strategies that work so much better. But they're strategies that you and I practice every day in the session. We sit down and we say, how are you? Now, a little tip around firefighters, first responders, never use feel. Never ask them how they feel. That's in North America what we call the F word, because they'll tell you in no uncertain terms how they're feeling, but that's not what you meant. So you use a different phrase, and it's what? What was the hardest part of that call for you? And then they'll emote all over you, but you didn't go in directly because, as you can imagine, first responders need to contain their emotions while they do the work that's in front of them. Mm-hmm. So somebody might say, well, that's wrong. They're compartmentalizing. That's how they do their job. Later, it's okay to say to them, what was the hardest part? And they will tell you. And it's not always what you think it was. So it's full of excitement in the sense of you have no idea what you're going to hear. But it's incredibly rewarding work, in my opinion, being able to be with amazing human beings in what might have been just the toughest day of their life, the toughest day in their career. Do I go in with words of wisdom? No. I go in with a structured way of discussing things, and it is structured. It's not kind of a let's just grab coffee and hang out. That could get really wild. You need to contain it. But if you have the skills that you have acquired through marriage and family therapy training or other skill sets, then it's work that's incredibly rewarding. And there's a psychoeducational part in it where we're able to teach what we call normal and abnormal situations. And I don't like the word symptoms with that population, but signs and signals. For example, you in a debrief, you might say, well, one of the very normal things after situations like this, you may find you're incredibly thirsty. And there's always somebody says, what? I said, within a few hours after that call, did you find yourself drinking a lot of water? Maybe other things when you went off duty. Well, yeah, I thought maybe I had contracted diabetes suddenly. No, that's normal in an abnormal situation. Or if you're a firefighter and you had to take a 16-year-old out of a smashed car, and you went home at the end of the day, you couldn't let go of your 16-year-old son. You were just hugging him, saying, "You're not going to get a driver's license till you're 40." And again, a normal reaction in an abnormal situation. Trauma work, it works for me, perhaps because of my background, perhaps because of all of the Boy Scout training I had around being prepared, being able to walk into a disaster and create order in the chaos. That's a firefighter language. They try to create order in the chaos. It works for me, doesn't for everybody. But the skills I've learned there on being able to sit and hear very horrific stories without commenting, without telling someone how to fix it. And I won't give you details. That's not what we're attempting to do here. But just that idea, I don't need to fix this. What I'm hopefully doing is helping this firefighter, police person, or a doctor make sense of the perhaps nonsense so they can continue in a career that they're obviously good at and they've chosen to do. I talked to a firefighter, a captain, maybe a chief, last summer at an open house at a fire hall. We got chatting. I told him what I did when I was working. He says, oh, then you'd know all about PTSD. And I said, oh, yeah, I've read a few books. Well, we got laughing. And he says, well, I know what it is and I've had it. But he said, I learned something. I learned something about how to take care of myself and still do the work. Because what happens with a lot of folks when they get PTSD, they don't overcome it and they quit. That's a choice. I get it. He said, I have learned that when I roll on a scene, maybe the first one on the scene of a crash, and I see something awful, I say, I did not create this. I did not create it, but I'm here to help people in the midst of it. And that for him helped him disengage a little bit so he could be effective. I could go on for hours, Selma, as you know, but I really
How
enjoy
did
trauma work.
how did you learn to disengage? Because one of the things that I remember working in frontline is that I started to not, and this was when I was still a student, um, that I started to hate my name. And this was during COVID, the pandemic, where I would hear the clients' voicemails and there was nothing I can do. And there were clients that were in very tough situations, and I started to really just get troubled when I hear my name because I feel like I can't help. There's that burden. But also that I have to answer the call and hear what they're going through. So how did you manage to stay far removed from some of the stories and not get secondary trauma?
Good question. I think I did it better some days than others. It would depend a lot on the case, on the situation, on what I was hearing. And it was something that triggered my own stuff from way back when. Those were a little harder because it hooks on my own personal stuff. But I learned how to say, okay, that's my stuff. It's not the caller's stuff.
Mm.
This what I'm hearing belongs to the caller. This is not my stuff. Yeah, it's rattling some of mine. I'll deal with that later. So
Mhm.
there's a big piece right there. And I guess, well, it's a good question. I can ponder and we could chat about that for hours. But I think it's being around it long enough to know that I really can't solve anybody else's problems. And sticking to let's say, the first responders, if the firefighters are meeting with them after a situation where somebody died in a fire,
Mhm.
think about it for a second. Nobody can fix that. The building's burned down, somebody's died, a family's been disrupted, all kinds of memories are gone up in smoke. What do you do with that? It took me a while to sort of step back and say, you know what, there's nothing I can do about that,
Mhm.
but I can work with this firefighter and this team to help them manage their own feelings about this so that they can stay at the work that they love. They love to do it. But if they carry around and pile up those stories and don't process them, that's a clinical term, they don't come to terms with it, then they will never be able to do the work. None of us can. It's the same with a therapist. If we take on every situation that the clients bring to us, burnout's going to happen real fast. I've heard stats where 5 years frontline and you're done. I think that's a little pessimistic. I think this, well, I was at 35 and think I was still doing pretty good at the end of that. But again, I am not taking on that problem. I am helping the person gain some insight so they can do it. Because the bottom line is, I don't think any therapist has wisdom that we can share with somebody that they will take and not tweak it a little bit and then get on with their life. It's our job, I think, to help somebody. No, I believe this, to help somebody dig up their skill set to make their own choices with a little guidance from us, maybe guidance in the sense of, well, what would happen if, or how would that look if? Because as I can say, if someone tells me what to do, I might do it. But if someone encourages me to figure out what I'm going to do, I will do it.
Mhm.
Human nature, I guess.
Mhm.
So it's I think, a continual ongoing growth process of becoming aware when sessions are getting to us. I mean, if you've had, oh, I'll give an example. I mean, I'm old enough to have family members die and fly out to the east coast of Canada, where it's home for me. And I'd come back after having been at a funeral and it was really upsetting. And I was a little bit bruised emotionally.
Of course.
I said to the intake staff, I do not want to take any new clients that are coming in for grief work. Not now. Give me a couple months. So it's knowing when we are, let's say, hurting a little more than normal or average because of what we're going through, and to be able to say, I can't do that right now.
Mhm.
Doesn't mean I can't do it later. But that's part of it too, being able to disengage where appropriate, or maybe refer out. A client might come in and they'd be starting to tell a horrific story, and they go, "Oh, I didn't want to get into it."
Mhm.
Now, we have an obligation as therapists, as you know, to then refer out appropriately, but you do it very clinically and cautious. Just along the idea, I don't think I'm the person for you right now, but I know people who are much better at this than I am. I mean, there's ways to do that, but doing trauma work has its risks because you don't know what you're going to hear.
Mhm.
Just as in any therapy session, somebody might come in and you think, oh, the person's coming in because they're sad and lonely. You think, oh, yeah, okay. And then you find out they've been arrested just before they came on a charge of murder.
Mhm.
That's always exciting when that happens. And that's not just one. I've had several like that. Or they're coming in to tell about a story from work. And then I realize it's what was on the headline on the news last night. And I'm thinking, oh, I didn't see that coming. So it's it's being it's looking after ourselves and knowing what our limits are and knowing our role. Back to the idea of the firefighters in a debrief after where it's been fatal. I would ask questions eventually, like this is structured, but at some point I would say, so what resources have you guys to pull on? Do you have to pull on to give you the strength to take the next call? Uh, I remember talking to a paramedic, brand new paramedic, had all his training on the first rotation, the first shift. He and they go out in teams here. There's two of them. Go to calls. They had three vital signs absent. Very first shift. Those that maybe not medically inclined that are listening, basically the person's dead before they got there. But paramedics are taught to rescue. So if they go in thinking every call I'm going to go and save a life, well, first off, you can't do that. If you really want to have a good discussion with firefighters or paramedics around the stats of that, the public assumes if an ambulance rolls on scene at a, say, car wreck, oh, everybody's going to be fine. These are professional people. Well, if it's been more than 2 minutes, they may already have passed, and there's nothing can be done. But if a paramedic's training has been that paramedics are trained and held up in the eyes of everybody as lifesavers, that they'll come in and they'll clean up this mess and everybody will walk away smiling. And unfortunately, that attitude still exists. And I understand it. Nobody likes to look at a car wreck and say, oh, this is okay. But for the paramedic who has that attitude, they will be blown away with that kind of a shift. And they need to have an adjustment of their mindset, of their belief system. They need to deal with what we're calling nowadays moral injury. And you may be familiar with that term. In other words, they see something that is so outside of normal, their definition, not mine, that it's just sometimes they can't function.
It's so upsetting or disappointing, right? Where they get so disappointed.
Yeah. And they may look back, well, I picked the wrong career. People told me we could save lives. They lied to me. There's no sense in me hanging on to this job. I'm not effective. I think I'll become a plumber or whatever. But I can work with that. A therapist can work with that thinking in a debrief, or better still, back in a session, maybe a week after that. So trauma work, let's get commercial for a second. If you do some trauma work in a way, depending, I don't know what your opportunities are there, but I used to go in and do trauma work for free. But at the end of the session, when we always stood around for a little bit to have a coffee or tea or a glass of water or some cookies or something, somebody would walk up to me and say, do you do any kind of counseling? I said, well, of course, I got to play dumb, which is easy for me these days. I would just say, well, what are you asking me? Well, do you ever work with parents and teenagers, or do you ever do couple counseling, or do you ever do career counseling? Yes. So suddenly, I then have maybe a fee-paying client that I would never, ever, ever have reached before. So there is some commercial payback. Let's be honest, it's there. And I don't know about you, but as a therapist, I needed to make money.
But I noticed that in many of your stories, there's you able to walk into a room of, I would say, with firefighters, it's very close. It's a closed group, right? They believe that their experiences are not going to be understood by others. It's not easy to trust an outsider, but somehow you always get them to trust you. And I think it's because
Yes.
somehow you can relate to what they're going through, because I could imagine, like you said, a therapist walks into a group who just experienced a horrible traumatic event. They're going to be coming in with a lot of wisdom, right? On, why these things happen or trying to make sense of it. But how did you find your way in gaining trust and um, yeah.
It was done outside of trauma. I got to know the chaplain for the fire department. I've got to know a few of them, by the way, and it was a good fit, which is nice. And he used to go around to the stations, I don't know, every month, couple of months, sit down, have a cup of coffee. And if you know, I don't know what it's like where you are, Fire stations are like a home because the people who work there are usually there in 24-hour shifts. So we'd meet in the kitchen with a big pot of coffee and a pile of homemade cookies that some firefighter had just made. And we'd just shoot the breeze, as we say here. We would just chat. They got to know us. And they knew the chaplain because he'd been doing this. And then the chaplain said, "This is Ron. He's marriage family therapist and he does a lot of counseling. And oh, by the way, he's got a lot of training in trauma response." He looked at me like, "Oh, so this sounds corny, but I got endorsed by the chaplain. And once the chaplain says I'm one of the good guys, then the firefighters will accept me as one of the good guys." That may sound very hokey
Yeah, can
or
you define
silly.
what is good guys? Like, what would be good guys
Sure.
to them?
Oh, sure. That's a good question. Yeah. Well, um, without going into a lot of details, I know of a couple of cases where a very well-meaning therapist
Yeah.
uh, heard about a bad call, went up to the fire hall and knocked on the door and said, I want to come in and see if I can help you guys. And came in, and firefighters are usually pretty courteous, usually, but they're already ticked off. They're already upset. Who just knocked on the door without making an appointment? And this person came in, got them all sitting down, kind of in rows, if you can imagine, not around their table, in their home, in their kitchen. Okay. Be like going into your living room and said, "I'm here to teach you stress management." And I can imagine with what you went through last night, you can use some help with that. They gave this person about 5 minutes and said, "Thank you. This has been the most amazing meeting. Thank you so much for coming here. Let me help you out the door. We got to get doing something else," which basically meant they didn't want to see another therapist ever.
Again, yeah, I
So,
can imagine.
and in all fairness to the therapist who came and knocked on the door, their heart was in the right place.
Mhm.
Their training wasn't. That's not how you approach those folks. A couple of the things too, believe it or not, my experience in working in the automotive field, I got to work with a lot of people who used language that most people would find politically incorrect, vulgar. I didn't have to speak it, but I knew that was their language. So if you go to a disaster call out, firefighters, police, paramedics, docs, nurses, they have a language that is unique to their work. It may be crude, it may be politically incorrect, but that's how they relate and how they blow off tension. The last thing you want to do as a newbie therapist is to go in there and you hear somebody cuss and say how beep, beep, beep bad that call was, to say, you really need to relax. You need to deep breathe and speak clear English. I know what they'll say to you, but I won't say it on tape, okay? Yeah, you need to be comfortable, probably the wrong word. You need to be able to sit with that and maybe translate. Uh, I had to intervene in an intervention one time where a young therapist who had some training we had agreed she'd start the call out, start the intervention. And one of the firefighters was so upset with what happened, and he cut loose with a string of obscenity that was unbelievable about himself, the fire department, and how upset he was with that work, that with all their skill, somebody still died. And she, unfortunately, scared half to death, said, "Please calm down and don't swear." I thought, oh my. So that's a true story. I very quickly jumped in and said, "Well, if I may comment here," I looked at the person, the firefighter, and I said, and spoke very slowly and deliberately and said, "I am absolutely amazed that you were able to come and sit with us here in this meeting tonight. I can tell you're upset. And I'm really surprised you're not even more upset. Thank you for coming. I really appreciate your comments. Will you stick with us throughout this session? Because I know you're going to have some ideas and suggestions that'll help all of your coworkers here. Would you be willing to do that? At least help me do that?" He
Wow.
looked at me and says, "Okay." That was it. What did I do? I recognized him. I authenticated his experience. I let him know it was pretty normal, and I congratulated him on his wisdom, and I invited him to stay. Isn't that about building bridges? Isn't that what we do in therapy?
And you
And
honored that
that's
he
what I
has
did.
something to share with the group, not that we're going to educate him on how to calm down, right?
You got it. I don't know about you, but has anybody ever told you to calm down when you're really in a bit of a hissy? I
Yes, my
know
husband.
my,
It didn't work very
well,
well for him this week.
you tried it. Or over the years, I've told you about my struggles with dentist work, and I don't like it. And I still remember different times I'm in the chair and they're ready to do whatever, and I'm freaking out like, and they look me in the eye and say, calm down. And I look at them and say, too late.
I don't know about you, but the
So
only
yeah,
time I calm down, it's when someone tells me, that my anger is valid. If it's valid, then
yeah,
I can cool down. No.
yes, isn't that paradoxical?
Yeah,
But that's
absolutely.
what we need to do in therapy, whether it's trauma work or whether it's in marriage counseling or a parent with a teenager they're ready to give away, or maybe someone with an infant. What's that old nursery rhyme about rockabye baby in the treetop?
Yes.
I'm curious about that one. How'd the kid get in the tree? Was this a second story nursery and the mom said enough of this and threw the kid out the window? I mean, I don't know. So being upset is normal. And once you name it, it usually calms down. Trauma work is unique. It's maybe another way to look at it, I suppose. It's you take a situation that you might have in a session about other topics and you just add some steroids to it. You crank it up. But I like it. Other people don't. They won't go near it. They don't like being in a fire hall or wherever that situation. I mean, I've been called to campsites where I'm sitting, summertime when it's warm. You're sitting out in the area, maybe outdoors, or you're sitting in a shelter with people around you, or I'm sitting in the garage in the back end of the fire hall, or I'm whatever. And some people say, well, I only do therapy in my office.
Mm.
Okay, but then you're not going to be doing trauma work.
Yeah.
However, you may in your office meet the therapist, a client. It's a couple shows up, and the complaint is we don't talk. Communication is poor. And when I ask who does what, and one of them is the firefighter or a cop or a paramedic, and the other one's not, I know exactly what to do. I would say something that within the first 5 minutes, I'd look at whoever it is, the first responder, and say, "So let me guess, your partner says that you don't talk enough about your work. Like they ask you how was your day, you've had the day from hell, and you don't want to give details, and they're mad at you for not sharing." Yeah, comes the response, and I said, "I'm amazed that you care that much about your partner that you don't want to share those ugly details." And that person goes, "Oh." And the person who's not the first responder says, "Oh, I never thought of it that way before." So then we discuss how can the first responder share the call, the day, without the gory bits, if you will, or the stuff that was awful.
Yeah.
Or, it might be, well, we had a call today and it was a big birthday party in the backyard and it was a birthday party for the 6-year-old and unfortunately fell in the pool and drowned. And they have a kid that's 6.
Yeah.
So the first responder needs to say to the partner, although nowadays, by the time you get home, it's been on the news and they know exactly what happened. But you still come home and say, well, it's really upsetting me. What happened upsets me because we have a kid that age. Now, that can be shared, but not what happened in the rescue process. That doesn't need to be shared. So you can do some education. If you have trauma work and you don't want to do debriefs, you can use that within your everyday session around other stuff like couple counseling, whatever.
Yeah. That's quite incredible. I think that's been wonderful. Let's put a bookmark here. What do you have in mind for our next recording?
Well, I'll tell you what, I'll do some thinking on it and maybe send you a note or two so we're kind of